Lower Back Anatomy 101.
On the bottom here, we have the pelvic crest bones. Up here, we have the lower ribs on both sides. This is the Erector Spinae group, which is comprised of 3 separate muscles. And then on this side, we have the Quadratus Lumborum, also known as the QL muscle. Here we have the lateral intertransversarii going between the transverse process of the vertebrae. Underneath the Erector Spinae group here, you can see a cutout, and then you see the multifidi muscles underneath there. Inside of that is another cutout, and you can see a disc herniation and a little nerve there, and red in the nerve because fire, pain, nerve. The groups of the 2 little muscles are the Interspinalis lumborum muscles, and those go between the spinous process of the vertebrae. These muscles are the Rotatores Lumborum. And then up on the top here, we have the Costal Levators, and they just help hold up some of those bottom ribs. Let's talk about the disc herniation for a minute. A lot of people like to use an analogy of a jelly-filled donut to describe a disc herniation, but this is not very accurate. A more accurate analogy would be to say that a spinal disc is like a car tire, and that the filling is more like chewing gum versus jelly, which is very oozy, gooey.
You're not fragile.
You're not fragile. Discs are not super fragile. They're pretty durable. And for anyone who's experienced sciatica, it usually originates in the nerve near the disc where the disc is pressing into that nerve. And that's that shooting pain that can go all the way down your leg.